The pain that I had prior to surgery was significant in that the week or so before I thought, if someone would just cut this leg off, it would be better than to be limping around. My case was a little interesting in that I had only been in pain 6 months prior. I was climbing a mountain, climbing Mount Baker, and on that climb, I think the weight of the pack, getting up and down out of a crouched position, compressed what was left of an arthritic hip that I didn't realize was arthritic. So in August, when I was having so much pain, I finally came to Dr. Bowen by my husband's recommendation. And when he turned that x-ray around to show me my hip, and he said, "Oh man, there's the problem." And I was looking for some kind of a crack or a break. And he said, "You have an arthritic hip." And I thought, there's no way. I mean, I'm not 27, but I thought, I'm only 27. How can that be? And then he said, "You need a hip replacement." And I was in complete denial. In my life, I live a very busy life. I have a 17-year-old son who's active in lacrosse and hockey, and we live on a small pond, and we all ice skate, and I have grown up figure skating, and presently was playing roller derby, which at my age isn't something somebody usually takes up, but I can skate, so I've had a blast exercising that way. So that's what I had been doing, that's what I'd hoped to continue, and so faced with now an opportunity to have a hip replacement, I worried about, will I be able to do cartwheels? Because I want to do a cartwheel until I'm 80. I'm a past gymnast. I wanted to be able to continue playing roller derby because I was just getting the hang of the sport. And also in both derby and in figure skating, there's a move you do where your feet are out and you want to be able to get to that same plie position, if you will. And Dr. Bowen assured me that that would be the case, and 2 months afterwards, I was able to accomplish that. Since I've had my total hip replacement, I have been horseback riding, I've been snow skiing and downhill and telemark skiing, cross-country walking, hiking, snowshoeing. I've been roller derby playing, just not scrimmaging at this point, and I've been horseback riding. Dr. Bowen has been a blessing through this whole process. I knew that he was a great surgeon because he helped my mother. He's the reason she can walk as a 93-year-old woman, and she can go up and down stairs. So I knew then when I met him 5 years ago what a talent he was. But since then, having worked with him personally on my own issue, I have so much trust in him. I have personally recommended 7 girlfriends to him who have all had hip surgeries since I had mine 6 months ago. Dr. Bowen's orthopedic clinic is really outstanding in terms of their customer service. From the moment you walk in the door to meeting their receptionist, meeting the folks in the back who are taking your x-rays, all of the assistants, everybody is so helpful and caring, and you really feel like you are important to them. I would highly recommend Dr. Bowen Orthopedics to anyone. In fact, I have, to many people. Dr. Bowen, on behalf of the great work that you do and the several women who I have referred to you to have their hips done, we got together last week for dinner to compare notes and compare scars, and we thought, well, gee, let's take a picture and present this to you on behalf of all of us who are so thankful that you worked on us.
Amy, I'm honored. I love this picture. I can't believe you guys did this for me. Thank you.
It was fun.
Well, that is great. Thank you so much.
You're welcome. We hope you'll put it in your office.
I am going to, absolutely. Thank you.
Good.